simple liver cyst, located in the left lobe. Segment 3, a situation frequently encountered in practice. Subcentimetric lesions are identified during trivial ultrasonographic or imaging investigations, whether or not related to the patient's allegations. Not rarely asymptomatic. In this case, speaking a grayscale examination with the convex transducer. In a relatively overweight patient, subcutaneous cellular tissue and preperitoneal fat can be seen, which is abundantly represented given a thin abdominal wall, probably in a relatively sedentary patient. It is important to picture the liver, which is a liver with a homogeneous structure, a normal appearance. On the left we have cranial, caudal, anterior, posterior. The section we see is a longitudinal section, and we can also see the liver capsule with a linear aspect. The liver, which is with a homogeneous structure without signs of restructuring, important anatomical relationships with the heart. Anatomical relationship with the line of the diaphragm, also with the pancreas and stomach in this area. The layout is centered on this image that we see. It's a well-demarcated, moderately echogenic, oval-shaped space-replacing structure with a somewhat more echogenic center. It could correspond to a solid tumor formation. The aspect is demarcated at the moment, and I would like to highlight the idea of an oval formation. Oval tumors or lesions in general are more commonly benign than malignant. When such a lesion is detected, the next step is more advanced, sectional imaging. MRI shows us a lesion that is hypodense and could be a fluid formation. It is an easy image to understand because it is anatomical in nature, whereas the ultrasound examination is a focused examination of an anatomotopographic region. Again, returning, the next step for completion is back to ultrasound. So examination number 1, grayscale screening. Examination number 2, diagnostic confirmation and characterization. Examination number 3, vascular examination with contrast, which highlights during arterial the very well delineated and, more importantly, a vascular tumor formation. Therefore, the clinical context in a patient who is free of specific complaints with a good general condition, encapsulated oval lesion with an intermediate type structure, with an MRI appearance probably liquid, with an avascular contrast appearance, points towards a benign formation, probably a condensed cyst. The image we see here is the image in harmonic mode. It is the examination during arterial time. You can see the tumor formation on this image loop. It is the end of arterial time. We're from the 24th, 25th second, and we can see the appearance of the formation that was also seen on the frozen images. So appearance of simple sub-centimeter liver cyst with elements of a vascular condensation. The appearance is typical and requires periodic evaluation without further changes, without further investigation. Periodic evaluation meaning a clinical consultation, routine biology, and a stage eye checkup every 3 months. Then the interval is reduced to 6 months and annually thereafter, and probably even less frequently thereafter because we are talking about a benign lesion.